I wanted to talk about ankle injuries, not fractures, sprains mainly. Um, it's a very common injury, getting a ankle injury. You sprain, you step off something high, and you twist your foot. It's a very common injury, and what happens is, according to the textbook, you're supposed to keep your foot in a plaster cast for 3 weeks, and then uh, take it off, and then reassess. But what happens is, those 3 weeks spent in that plaster cast is usually excessive, especially in cases of minor injuries. And then when you take the cast off, you'll find that they've lost condition, and the pain's still there, and the swelling is still there. So that ends up leading to a lot of extra time spent off work or off from your activities, because you've now got another 2 or 3 weeks to rehab yourself. You need to spend another 2 or 3 weeks to rehab yourself. In most cases, after an injury, you need to check if there's a fracture. That can be done clinically, and you'll need an x-ray sometimes. Once you get the x-ray done and you confirm that there is no fracture and there's no major ligament injury, in which case it's now time to start thinking about how to get back to work as soon as possible. And the way I would like to do it is, if there's no major swelling, if there's no major pain, and they're able to weight bear immediately after the injury, then it usually means that the injury is not too severe, that there's been no major damage to the ligamentous structures. If there is a major injury, then there's going to be bruising, there's going to be massive swelling. So those are usually quite reliable indicators of how severe the injury is. Anyway, coming to mild injuries. When you get to mild injuries, what you need to do is stay off that foot for at least 24 hours to see how the injury progresses. So you stop putting weight on it for 24 hours, and then you wait to see what the next day is like. And if the pain is reduced, then you can start thinking about moving it again without weight. So as soon as you get back to normal movement of full range, so there's plantar flexion, dorsiflexion, inversion and eversion, and then there's a rotation, which is a combination of all of these. Once you can do these to full range compared to the normal foot, once you can get to the full range of movement on the injured foot compared to the normal foot, then you're ready to start weight bearing. I wouldn't want somebody to weight bear when they've got a painful range of motion, even without the load. So the idea would always be to get rid of the pain first in an unloaded limb, and then start thinking about loading the limb. So that first few days you're going to try and move it in a manner that is pain-free, or in a manner that has tolerable pain. And if you're doing it right, the pain should reduce the more you move it. If you're doing too much of it, it's going to get worse. The swelling is going to get worse. The pain is going to get worse after you do the movement, not during the movement. During the movement, you are expected to feel some pain. So once you get the full range of movement around your ankle, and you start being able to rotate it properly, you start being able to move it properly, then it's time to start putting a little load on it. The reason why I want movement rather than immobilization during recovery from an injury is because ligamentous structures and structures within the joint need movement for nutrition, and that movement is what causes blood flow to improve, both blood flow coming in and blood flow being drained out. Ligamentous structures and cartilaginous structures don't have any blood supply, so they rely on the blood flow in the surrounding tissue in order to heal themselves and repair themselves. So the regular way of immobilizing a joint after it's been injured, especially if it's a minor injury. A major injury, of course, you will need to immobilize, but especially if it's a minor injury, I would prefer that the joint be moved early. So that when you start moving that joint which has been injured, in this case we are talking about the ankle joint, when you start moving that joint, you're going to get more and more blood flow to the surrounding area, and that's going to improve the nutrition of the ligaments and the joint tissue, which doesn't actually have blood supply in it. Keeping it still, keeping that joint frozen and immobile, will cause the blood circulation to stagnate, mainly the venous outflow, because it's the muscles in the calf that need to move and pump out the venous blood flow back to the heart. And unless the veins are empty and flowing well, the arteries are not going to get enough blood into your ankle. So which is why I want this movement. Now here comes the problem, because standard, the normal, that's how people, when they think about ankle injuries, when they get an injury, the first thing they do is they put a lot of ice on it, and then they wrap it up tightly with a crepe bandage, both of which I'm against doing, because both of which will impair the normal healing processes that are supposed to happen when there's an injury around a joint. Putting some ice on it and wrapping it up tightly is something that you've seen happen on in sports events. Now these sports stars are being paid to play. They're being paid to use their bodies, and if they get injured during an event, they have no option but to push through. And for that, they need to keep the swelling down, and for that they need to put a crepe bandage around their injured limb so that they can somehow forget the pain and continue to push through. You're not being paid in millions to destroy your body, so you can't use the same methods that they use. If it's a minor injury, you will need movement, you probably need heat, and you will need to avoid restricting the movement with something like a crepe bandage. Now the crepe bandage, even if it's not tied very tightly, even that loose pressure on it will cause the venous capillaries to get compressed and impair the blood flow. So this is something I'm really against. When you have a minor injury in the ankle or the knee or whichever joint it is, people like doing something. They think that they have to do something in order to fix the problem. Most of the time the body knows how to fix itself, especially if it's a minor injury. Try not to interfere too much. So I'll repeat that once more. Move it in an unloaded fashion without putting any weight on it. Keep the foot unloaded. Don't put your weight on it for the first 24 to 48 hours. See what the pain is like, move it a little, and once you find that the entire range of motion possible in that joint is back to normal without pain, that's when you start putting on some load on it. And when you're putting load on it, you're again going to do it in a very guarded fashion, where you're not going to put all your weight on it on the first day. It's going to be partial loading. You're going to limp a little, explore how much load you can take without pain. You're going to use your hands and the other leg in order to support your weight more than your injured leg. And once you can do that you can do partial loading without any pain, that's when you start thinking about putting full load. And once you get to walking with full load without pain, that's when you start thinking about climbing stairs or starting to jog or run. Now running comes last, and even at that point, if you've got an ankle injury and you've got the ligaments and the joints disrupted, or if you've got them stretched out, the joint is going to take quite a while to reset itself, both physically, in the sense that the tightness of that joint will take time to come back. Also, the way that joint responds to neurologically responds, how it takes signals from the brain and then uses it to control the range of motion of that joint, that is going to take time to reset. So you shouldn't be doing anything really challenging for the first 2 to 3 months, especially when it comes to things like where in sports or movements where you need sudden changes of direction, or if you're walking or running on a really rough, uneven surface where the ankle needs to work really hard, or if you're climbing downstairs. Usually climbing upstairs, you don't have much of a problem, but if you're climbing downstairs, you are at a higher risk of twisting your ankle again. So it helps to be aware of these particular situations where you can have a repeat injury. Now, once you injure your ankle joint and it's unstable and it's loose, I'm loose in the sense not going to fall off. Loose in the sense it doesn't perform like it used to. Once it is loose, you have to wait for it to recover fully before you start challenging it like before. So you have to load it gradually. That comes out of being more observant about of your how the ankle works under different conditions. But just keep an eye on what situations you are at risk. So you'll hear people saying that I twisted it 5 or 6 years ago, and then ever since then it's always been bothering me. I twist it again and again. Over the last 5 years, it's been happening every few months. So that's because this joint is now physically loose, and also the nerve endings around that joint are not responding fast enough for control of that particular joint. So you'll have to take extra care of it, and that extra care of it isn't wrapping it up tightly. You need to rehab it, you need to move it, you need to challenge it through full range of motion, and you need to load it gradually. That's the way to fix the problem. Now, if you're having repeated ankle injuries, you'll have to also start thinking about why you're having repeated ankle injuries. Is it because your hip is not supporting your ankle enough? Is it because your hip is not reacting fast enough to a sudden balance challenge? Is it because your core is not strong enough and your center of gravity is being pushed and pulled without any proper control, and your ankle is taking the blame for it? Is it because your shoulders are not fully mobile and therefore your ankle has to compensate for that? So these are the things that you need to fix in order to prevent future injuries. So that was my short talk on ankle injuries. I hope you like this format.